So welcome. Today is April 29th, 2021, and I'm Tiffany Scruggs with the Washington Procurement Technical Assistance Center. I'm joined today by Alicia Rodell with the Ptac as well. And we're delighted to have guest speakers today from the U.S. Department of Health and Human Services. If you could go back one slide there, Alicia, we'll talk a little bit about the Ptac program. We exist to help small businesses and businesses in the government marketplace succeed in winning more government contracts and subcontracts. There is a Ptac in your location, hopefully, across the country if you're joining us from out of Washington State. And you can find your local Ptac at the Association of Ptac website listed on the screen. Or if you're in Washington State, trust that we have a robust team in all corners of our state ready to support you in your government contracting success efforts. So please reach out to us. We are funded in part through a cooperative agreement with the Defense Logistics Agency, which allows us to provide our services at no cost. So we can meet with businesses and talk about a marketing strategy, how to bid, we can review your proposals before you submit, we can help you get paid, and everything else in between. So please reach out and utilize your Ptac services. They're there for you to help you succeed. So with that, let me go ahead and introduce our speakers today. Karisma Horne is a procurement analyst with the U.S. Department of Health and Human Services, and she's supported today by Michelle Street, the Office of Small Disadvantaged Business Utilization Deputy Director. So a great group of folks here today who are very smart on U.S. Department of Health and Human Services contracting and how small businesses can do business with them. So with that, I'll mute myself and my video and turn it over to Karisma Horne to take us through the presentation.
Thank you, Tiffany. Alicia, you can advance the next slide and start the video.
The Department of Health and Human Services has 11 operating divisions.
Do you mind stopping the video, Alicia? I'm not seeing the video. I'm just seeing a black box again. So sorry for the technology difficulties, folks, today. We are recording, and the slide deck will be available after today's event. So maybe undo the black box hiding that you did earlier, Alicia. I think that messed up the video test that we did earlier. Sorry.
So that's okay.
Hang tight with us here. We'll get that going. It sounded great.
Oh, maybe.
And for those of you who just joined, welcome. You're invited to ask your questions in the chat or the Q&A. We'll be monitoring that as we go. And we're just right now working on getting a video going for everyone to see.
And Alicia, if the video doesn't work, we can move past it.
Since I hid the controls, I am having trouble getting them back up.
No worries. I'll go ahead and get started so it doesn't have to be any additional delay. That's fine with you. All right. Good afternoon. The mission of the Department of Health and Human Services is to enhance the health and well-being of all Americans. How do we do it? We touch the lives of everyone in this country. As for the Ostaboo mission, simply stated, is to support the HHS mission, utilization of small businesses where possible. Next slide. The Ostaboo is under the division of the Office of the Secretary. The Ostaboo reports to the Deputy Secretary in the Office of the Secretary. We administratively report to the Office of Acquisitions. Within the Office of Acquisitions, we have a Deputy Assistant Secretary. His name is David Dasher. He is also our Senior Procurement Executive. Katrina Brisbane is the ADAS and is currently acting as the Director for the Ostaboo. Advance the slides. One of the most important things you need to know when you're trying to do business with HHS is how we're organized. When doing your research, you have to understand our operating divisions, AKA optivs, and our staff divisions, AKA staff divs. On the left is our operating divisions, which are areas that you are familiar with, like the Food and Drug Administration, Centers for Disease Control, and the National Institutes of Health. On the right side of your screen are our staff divs, and they provide oversight to the operating divisions, OpDivs. The Office of the Assistant Secretary for Financial Resources, ASFR, is where the Ostaboo sits. Next slide. Here's a brief description to begin to understand the Hhs portfolio. Here are some examples of some of our bigger programs. The National Institutes of Health is the largest biomedical research entity in the country. There's a lot of vaccine research done within NIH. There's about $1 billion spent in R&D a year. NIH purchases a lot of IT and lab equipment, construction services, scientific and technical consulting. There's a very large staffing contract for scientific support, which is Kelly Services, where about $280 million is spent annually, in which there are a lot of subcontracting opportunities available for you as a small business in that area. Some of the small business friendly procurements within NIH include construction, IT, administrative support, and janitorial services. Centers for Medicaid and Medicare Services, CMS, they deal with the fraud, waste, and abuse of Medicare and Medicaid programs. They also implemented the Affordable Care Act, also known as Obamacare. CMS spends about $2 billion a year, and most of the purchases are in IT. Some of their prime contractors include Accenture, Booz Allen, Serco, GDIT, and more. They have a lot of contact center operations and call center support. CMS most common procurements for small business include advertising, data processing and hosting, computer system design, and administrative and general management. Indian Health Services. They provide health services to American Indians and Native Americans. The IHS procures services, goods, and support of federal activities and projects. These include general and specific and special rehabilitative services, medical, surgical, and dental equipment and supplies, computer hardware and software, office machines, supplies, and more. They also have temporary help solution in terms of medical and physical services, physician services for doctors and nurses. We have the Food and Drug Administration, FDA. They regulate the manufacturing of food, drugs, biological products, and medical devices to include veterinarian drugs, cosmetics, and ensuring our food safety supply. They also regulate the manufacturing, marketing, and distribution of tobacco products. Some type of procurements for small business that they award are consulting services, public relations, advertising for educational and drug campaigns. Next, we have the Centers for Disease Control. They respond to disease and illness outbreak like COVID-19 and Ebola. They spend majority of obligations on vaccines. However, they do have many opportunities under the simplified acquisition threshold, which some of their small business procurements are IT equipment, staffing, IT supplies, and lab supplies. Next slide, please. ASPR. ASPR coordinates the national response to disasters and emergencies. They're big now to what's going on with the pandemic in the news. Some big programs for ASPR include BARDA, which they support the medical countermeasures such as vaccines and drugs, but they also have oversight for the Strategic National Stockpile. Some common procurements for ASPR include construction, professional scientific and technical services. Last but not least, we have HRSA. HRSA focuses on improving the healthcare to geographically isolated and economically or medical vulnerable. They allocate funds to end the HIV epidemic. They do a lot of grants and contracts in the bone marrow and cord blood donation program that goes unknown. Some common procurements for HRSA include convention and trade show organizing, computer system and design, and computer-related services. Next slide, please. Geographically, HHS is organized into 10 regions. Each has a regional director. We have about 85 employees across the 10 regions. As you can see, our buying is very decentralized. We have about 11 heads of contracting that make decisions that oversee about 50 contracting offices. To support the Hhs portfolio, currently the Ostaboo has 7 small business specialists, which we have one today on the line with us, Mr. Wayne Berry. Hhs also obligates close to $2 trillion a year. Next slide. For FY20, these are our small business goals. This information that you see here is what we have performance-wise. Hhs has exceeded our small business goal, which we are so excited about, but we have a lot of work to do with Hubzone and SDVOSB. Even though we did not make our goals, it's the highest we did not make our goal in those 2 areas, excuse me. It's the highest that we've ever been, and we continue with initiatives for Hubzone and SDVOSB programs. If you as a small business is interested in our Hubzone and SDVOSB initiatives, we are spotlighting businesses as yourself on our website and showcasing them in front of our acquisition professionals. If you are interested, please reach out to us at our Ostaboo customer care at sbmail@hhs.gov. Next slide, please. These are some of our top 10 NAICS. I won't go over all of them, but as you can see, this is for Hhs overall, computer system design services and biological products. However, on the next slide, you see our top NAICS for small business. There's definitely, when you get home today or when you do your research, there's some overlap of the 2 slides, but there are definitely areas as a small business that's where you want to look. Next slide, please. This is our Hhs top prime list other than small. When looking for subcontracting opportunities, this is where you as a business want to start. Our Big 10 has lots of vaccines, lots of pharmaceuticals, and lots of IT. All of these companies that you see displayed here have subcontracting liaison offices, and you should be able to contact all of them for your small business opportunities for subcontracting. It's a great way to get past performance, so please take advantage. Next slide, please. In doing business with Hhs, here are 9 or 10 things in no particular order, but all equally important that we would like you to focus on. First, we would like you to create a profile in our SBCX system, which I'll do a demo shortly for you. We will also like you to do this because we no longer accept hard or digital copies of your capability statements individually. We ask that companies as yourself create a profile, add your capabilities to the system, and you can go into the portal and upload and fine tune at your own time. You can go in and edit whenever you want and keep it always current. By uploading and fine tuning your profile, it is searchable by everyone in Ostaboo and our Hhs acquisition professionals, and this is what you want. We also want you to, on this site, you can visit our forecasts. You can access that on ostaboo.hhs.gov. We want you to search betasam.gov for Hhs sources sought notices, special notices, and solicitations. I'm sure that Marnie, Alicia, and Miss Tiffany at your Ptac has already shown you how to do that, but that is a great way to utilize them. We also want you to attend Hhs virtual vendor teleconference outreach sessions. They happen every second Tuesday of the month from 9 to 4. Our registration opens 2 weeks prior at 7 a.m. and it fills up very quickly. But if you can't get in during that time, you can always attend up to 3 times a year as a small business. Within this site as well, there's a list of Ostaboo events on the website that you want to register for right from the portal, and I'll show you how to do that in the demo. You want to also know how and what the agency buys. For example, IT is purchased through NITAC. We purchase a lot of IT through our NITAC program, and our NITAC program sits within NIH, and they award and administer the CIOSP 3, now 4 small business. We also have CMS, who also has an IT contract called Spark. So you want to make sure you check those out. Next slide, please. Please review our HHS FY21 budget in brief. It tells you from a money perspective where the money goes, and it gives you an idea on what the priority is for the agency. And if you have a solution that falls within the priorities, that's where you need to target. We also would like you to look at our Hhs Strategic Plan. Every 4 years, Hhs updates its strategic plan, which describes the work and address multifaceted issues involving the health and human services. You want to make sure you align what you're doing to those goals and priorities, and depending on your solution, show where your value add is. If you have innovative ideas and want to meet specific research needs for Hhs, and you have R&D needs and solutions, you should contact the SBIR and STTR programs. We have a couple within NIH and FDA and CDC, as well as the Office of Children and Families. All right, next slide. All right, time for our demo. To grow your business and to learn how to do business with Hhs through our small business customer experience, our small business programs, our events, our outreach sessions, our forecasts, and more, we would like you to please register your company for our small business customer experience. And Miss Alicia, is this video able to work? Can you show that one?
I think I got it to work. So
perfect.
Alicia, we're still seeing the gray bar. Oh, you're on it.
Yep.
Multiple systems, varied forms, repeated efforts. Throw in the FAR and it really becomes a challenge. Isn't it time for a change? Imagine everything you need in one cohesive ecosystem. Introducing the Small Business Customer Experience. We make communication easy, providing access to all of your favorite systems through a single customizable dashboard. Track your progress from beginning to end and see the status of a review at a glance. Want to pull reports, print summaries, or start your market research? No problem. Looking for tools and templates? They're all right there at your fingertips. You can even upload opportunities in the Hhs Procurement Forecast Data repository, then automatically populate the material into the Small Business Review System. Need to fill out that Hhs 653 form? With the click of a button, you can transfer the information from the PFDR. Oh, and we've automated the FAR. A simple question and answer format guides you through the requirements in plain language, compiling all of the data to expedite the review process. The Small Business Customer Experience also helps small businesses find everything they need in a unified format. Just set up a profile and enter your company details once. Check forecast data, interface with multiple federal systems, and easily search and register for OSDBU events. You can even upload business capabilities, catalogs, and company literature. Our system is streamlined and efficient, so you're free to focus on growth and new opportunities. Acquisition professionals, feel great about the small business process. Small business owners, come in, create, and leverage your profile. We bring our customers and their data together. Log in today and see how the small business customer experience can make your job easier.
Thank you, Alicia. I'm now going to change over into the demo, so bear with me. Are you able to view my screen, Miss Alicia?
I can see your screen.
All right. All right, so this is our small business customer experience, and it's really easy to register. Here's how you register. You go to ostaboo.hhs.gov. Once you get there, you click on this registration button right in the right-hand corner. You enter your name, you enter your company's DUNS number, you enter your security info. One important tip, and I have included instructions to your Ptac to give you once the presentation is over today. If the email address you use to register matches the government POC entered in betasam.gov, you'll be able to log in immediately, right? If the email address does not match the government POC entered in betasam.gov, you will need to ask the government person who is the POC to register you. If they have to register, if they haven't already, they will need to register and then activate your account. So once your account is activated, you as a small business will be able to see, your screen will look like this. You'll be able to edit your profile. At the top, all your credentials will come up here. You will also be able to go and add your capabilities. And this is a demo, so it's some stuff already in here. Disregard, you'll just use it for you. You'll be able to enter your capabilities in the capabilities field. You will also be able to put keywords to be searchable for all HHS acquisition professionals. You would also be able to upload your capability statement, any literature, any additional brochure. Your small business information will come port right over from SAMS, your small business designation. You just fine tune the portal. So you want to make sure you add your company's logo up top. You also want to make sure you do all of this adding in our file, in the file management section, really easy. You can upload PDFs, Excel, and Word file documents. You also want to make sure when you do add your information, you want to make sure you show your value add for your products and or services. Your contract data will come right over if there is any from port over from sam.gov, as well as you want to make sure you take a look at this section. This is our Hhs Operating Divisions. Once you do your research and see what operating divisions that you can show your value add, you can engage and provide a description of the benefits that you may offer per octave. So that is something that you want to make sure you take advantage of. Also, we are here at the landing page. Within the landing page, you have this section right here, right for industry. I'm not going to cover all the tabs, but I'm going to show some tabs that I think will benefit you for this demo. So this is the tabs that you have access to. One important tab that I think would benefit would be your information, your tools for small business. And within the tools for small business, you have late payment assistance. If you need help with resolving any issues regarding late payment. Also, this interest and specific opportunity section, we want to, if you have an opportunity, we want to hear about it. What you would do is be specific here, and it sends a link right to our email address. You would talk about the name and the contact information of the contract officer where you saw that opportunity. You will also include this specific information, okay? Another great tab on your left would be your forecast opportunities tab. You can search our Hhs forecast by NAICS operating division or by title. And this is a great way to allow you to get procurement information. And it's not on this demo side, but if you do search an opportunity, there is a way that you can export the opportunity right to Excel and get all the information there. The last tab that I think may be of interest to you is our Target Optives tab, Target Marketing tab. This tab allows you, and it needs to be updated, but it allows you to see our HHS spending trends by optiv and staffdiv, and they're unique one pages that you can click on per all the optivs. You can print out, you could use, look right on the computer, and you can use where need be, and it'll tell you some HHS spending trends from there. Also from this tab, and you can also get it from this tab or the main page, is our Ostaboo event tabs. So all of the upcoming events that we have, we post them here. The unique thing about this is it's an Eventbrite registration, and all the upcoming events you can register right here, very easy, and you can export once you register right onto your calendar. So this is pretty awesome. Now that you guys know where to go, we do have some upcoming events that may be of interest to you. So make sure you take a look at that. Also, let me see, within the main page, sorry, demo site, I forget. We also have on the main website, we also have some opportunities for you where it talks about different updates on with COVID response and things like that. It's a ribbon on top where it shows some upcoming news and things that we have coming down the pike. Michelle, was there anything else you wanted me to cover for the demo?
No, I think that's great. You can keep going, and if anybody has any questions about the site, then maybe we can jump back in it and keep it up.
All right. Well, last but not least, which is very important on the site, is when you do go in there, we have a small business FAQ, and this is for you to take advantage of. It talks about the capability statements. It talks about meeting requests with your small business specialists, and the specific opportunity stuff I went over. It also talks about financing and business development assistance, which you probably have help with that with your Ptac, but these are some additional information that we do have. And that's about it. Miss Tiffany, we can go to the Q&A when you're ready. And Miss Alicia, on the last part of the slide, I will stop sharing my screen, is our contact information.
Very good. Thank you for that. And I apologize for folks that saw the little black boxes on there. That's a strange phenomenon that we're experiencing today that we can't get rid of. But hopefully you were able to see that, and you can navigate over to the Ostaboo HHS website and experience it full screen with your own clicking after today's presentation. So we did have a few questions come through. Before I get to those, I did want to kind of stay for a second on the portal, the small business or the SBCX portal, and wanted to know, once folks fill that out and they're in there, there's a tendency to sit and wait and then maybe not have anything happen. So wondering, what is the expectation after they get in there? What next steps do you recommend a small business do?
Yeah, so
sorry, I couldn't find my mute. Go ahead, Michelle.
no, you go ahead, Karisma.
Oh, go ahead.
Okay. Yeah, no. So this is not necessarily, government contracting is not necessarily a linear process, right? So there are things that we do to build relationships, to get information about your business out there. This is a tool to get your business out there. And the reason why we do this, and I didn't hear, so forgive me, Karisma, if you said this or not, but the benefit of creating a profile and updating and uploading your capability statement or your catalog or whatever other, list of labor categories or whatever, first you need to realize it's only visible by HHS. So that's the first thing. All right. The second thing is, if you give that information, for example, to myself or Karisma, myself and Karisma are the only ones that have it. And then you are relying upon us to disseminate the information, which we're not going to do because we don't have that time. And then also for us to remember that information, if somebody were to ask us about someone, a potential source for a solution that's needed, which we're not going to do because we just don't have the bandwidth, right? And also when you give it to an individual, as soon as you go out and you get a contract or you increase offerings to your catalog, now what you've given me is outdated. So by creating the profile, what you're able to do is you're able to upload your capability statement, which is searchable by the entire HHS acquisition workforce, which includes contracting officers, contract specialists, and program officials, and everybody in the Ostaboo. And that's, well over 5,000 individuals in the acquisition workforce, probably more than that. And then you can also, at any time, if you wanted to do this at 1 o'clock in the morning, you can update your capability statement or whatever your offerings are at any time so that it's always fresh. So it's a way to keep a profile of your company out there that's fresh and searchable by all of HHS acquisition. So what's the next step? I wouldn't say that it's necessarily the next step, but it's another step. So from there, one of the things that you can do is if you review the information, learn about the mission of each of the HHS operating and staff division. Sometimes when people say, I'm contacting you because I want to do business with HHS. Okay, well, HHS has a $40 billion portfolio. We have, 21 operating and staff divisions. We have everything from selling computers and janitorial centers, janitorial service, all the way to vaccines for COVID, Ebola, H1N1. So what is it exactly that you want? Yeah, and then you have to figure out what area in HHS has a need for the solutions that you're providing. And you can do that by every office in HHS has their own webpage. So you have to dig. So then once you learn that, then you say, okay, these are the areas, get it down to 3 or 4. These are the areas that I think I, want to, have a conversation about. You reach out to your small business specialist. You can get a 15-minute appointment with them. Karisma mentioned this through the vendor outreach session. And we're having an Access to Success large outreach event in June, which we will be having rooms. Wayne, I didn't tell you guys yet, but we're going to go with the rooms, right? So each of the small business specialists and representatives from contracting and program will host rooms of 10 to 15 people to have the conversation, right? If you to have more information. So those are some of the things that I would advise for you to do next.
Great, thank you,
That's
Michelle.
just for starters.
Very good. I appreciate that. And
that's on a slow day.
On a slow day. And know that folks that were listening to that list, the Ptac program is available to support you in checking off all of those boxes and helping you get in the right place and the right strategy fine-tuned. So don't go into a briefing situation with a small business professional before without meeting with your Ptac counselor to make sure that your messaging is spot on and you're speaking the same language. All right, thank you for that. Do you mind, one of you, Karisma or Michelle, posting the link to that June event in the chat? Or maybe I could dig it up, but I think that will be another great event for folks to learn a little bit more and get a chance to attend those small meetings. That'd be great.
Sure. What I'll do is I will include the flyer along with the email that I include you with the PowerPoint presentation and the instructions on how to register. So you can put it together in one package. Does that work?
That works great. Thank you.
Okay.
And this recording and the slide deck and everything will be sent out to folks probably tomorrow. So you have access to that as well. So there was a question that was answered in the Q&A, but I wanted to just draw it out here. What is Fedramp required for software development services? Can you talk a little bit about what Fedramp is and how that is a requirement and how that all works? And I know Wayne is the one of them that answered the question. I don't know if Michelle, you want to take that one too?
I think I answered that one. Wayne, did you want to jump in or did you want to take that?
Um, hello.
Hi, we can hear you.
Hi. Hello, everyone. No, I'm good with that. As a matter of fact, I think Michelle is more versed in it because she's actually had to get something through approval to get my SBCX up and running. So she might be more able to talk about that. But basically, from what I understand of Fedramp is, the government wants to standardize this service so that it's and try to standardize the practices and the requirements so that we get a continuity of service without any problems. But that's all I have as far as that's concerned. I would encourage you to, because the agencies and are allowed to do things differently according to, and they report in. So I would encourage anyone who's curious about working at CMS to reach out to CMS. Our small business specialist there is Anita Allen, and she could talk maybe about any nuances that may be going on at CMS regarding that issue. I hope that helps.
Yeah, that does help, Wayne. Thank you very much. And you were spot on, right? It had to do with unifying the government's approach to the implementation of any solution that utilizes cloud services, right? And so, the government is a very large machine, right? We're the largest buyer, the largest single buyer in the United States. To what, Wayne, you probably know this number better than me, over $500 trillion, maybe more. That we are, the largest single employer in the United States. So, there's a lot that goes along with that machine that takes that to work. And part of that, as with any government, is a bureaucracy, and bureaucracies have to do with standardizations of different things, right? So there was a need, there was an observation that there was, a need to standardize how we adopt cloud solutions and integrate them into the federal government. And so Fedramp is what that is all about. It has to do with, security and best practices and other areas as it has to do with, cloud services. And so there are a couple of ways to get what's called an ATO, an authority to operate. If you go on the Fedramp site, it'll be listed there for you. I think I said in the email that, we don't answer questions in terms of every solution needs to have this, because we don't know that. The universe of HHS is too big for us to answer in that way. But given that, I would be very surprised if it were not. And so you need to have those conversations to see what's in place.
Great. Thank you for that, Michelle and Wayne. Appreciate that. It was mentioned at some point that when you register in the SBCX, your email had to be listed also in the beta SAM to pull the company's information over. Is it linked to sam.gov, the registration system? Is that what you're referencing?
Yeah.
So at one point, yeah, go ahead, Karisma.
Go ahead, Michelle.
Okay, so at one point before beta SAM, it was just sam.gov, right? And that's what we use to validate the small businesses. We're not in that business. We, that's, let, SBA have that. But we do have a hook into them that we validate, we verify company information through the DUNS number. So also to that point, and Karisma can talk more about this if need be, but your profile in SAM has to be public in order for it to talk to our system. So there have been a few companies who have said, yeah, I don't want my profile public because then I get all of this information. Well, then that's how it works. So SBCX is not a requirement. So in any HHS procurement. So just choose not to participate in that way, and that's fine. SAM is transitioning over to Beta SAM and then back to sam.gov. It's all the same.
Yeah.
Whatever you are required to do, we'll be able to see you wherever you are. Especially, they're going to move away from the DUNS to a user something identifier, either a UEI or a UIE or IUB. I don't know what it is, but it's some number that they're changing to instead of the DUNS. Hope that helps.
Yeah, thank you for that. Okay, very good. So I just posted in the chat an upcoming workshop on the changes between SAM and Beta SAM. We're saying goodbye to Beta, and SAM will just become the one place where you register to sell to the government, and you do so publicly if you're interested in getting into that small business CX platform, because that's
Right.
requirement there. That's
And they're
also
getting rid of FBO as well.
right. Yeah, FBO is now gone as well, and so
And
you
FPDS.
register. Yep. They're merging 10 systems into one, and so we have an upcoming workshop on that in June if you're interested in learning more about that. But pay attention, because the platform
Go to that
recently
web. I'm
changed.
sorry. Go to that website. That is a fantastic service that they're offering you, because you have to know how to use these systems in order to learn how to do research about contracts the best way. And I'm sorry, Tiffany, but while it's hot in my head, I have to remember these things because it's hot where I am, and my brain is frying. So we're 90 degrees in DC. If you know anything about DC, DC is like a swamp when it's hot. But in any event, the best predictor of what the government is going to buy in any agency is what they have purchased in the past. That is the best predictor. Our mission doesn't change, right? How we buy it, whether we go GSA or a GWAC or open market, or, full and open, or how we do it might change, but our requirements typically don't change overall, from a mission standpoint. So again, the best predictor of what we're going to buy in the future is what we bought in the past. Okay. And so the best way to get that information and the value of those procurements and information on incumbency is those types of tools. And Wayne, I don't know, you might want to piggyback on that because you're more boots on ground than I am.
I can confirm that it is hot. The chocolate I left some chocolate on the counter. It melted in the I don't know how that happens. It's hot. Oh, you're talking about the right. So FPDS and FedMine and I'm sorry, not FedMine. FPDS is the American people's free access to the records of federal buying. If it was not classified, it's going to be posted in FPDS. Now, it may not be the easiest information to digest. There may be people who offer that service for a fee, but you should know that that service is available to you at no cost. How they roll out this latest edition, whether you like it or love it or not, as a small business community, you have to let the government know what's working and what's not. We need that feedback. That's not to HHS, that would be to those who manage it. I believe all of that is managed under GSA. So
yes, GSA.
Yeah. So just to get you in the right direction, let people know how that's working, give feedback. If you need more data, if you need better data, all of that is important. I should have given this disclaimer before I came on. I'm a geek about this. I really embrace data. I love data and everything like that. Michelle is absolutely right. The government, what the government is going to buy is what we have bought, with the exception of construction stuff, is a great indicator of what we're going to buy. And the more time you give yourself to know, to plan and get yourself ahead of a procurement, the better. And that's where FPDS comes in, is that the past is a predictor of the future. So that's all I have on that. And
actually, if I could ask a follow-up to that question that came in through the chat, are there specific GSA contract schedules that HHS likes to work with? This particular client, Angel Man, is new on the multiple award schedule.
oh wow, I did too much. I talked too long, and now I got vote enough, get elected. So so the question is, are there procurement vehicles that HHS favors?
GSA schedules, I think it was, Wayne, right?
Yeah, are there GSA schedules that HHS favors? And the answer is the federal government is doing what's in their best interest. There are some GSA schedules that they may favor. There's 8A stars and things like that. But HHS is a unique place in that there is authority delegated from GSA to HHS to manage our own GWAC. And that's the NITAC. What we are seeing over the last few years here, again, I'm talking from a geek perspective, right? What I've been looking at from the data over the last few years is the number of contract opportunities for small business has significantly diminished while the government budget has increased. It's not just what we're buying, but how we're buying it. What the government is doing more and more is they're making these buys off of GSA. They're creating their own IDIQs. So an agency may create its own procurement vehicle that's separate from everything else. And you won't see those opportunities because they're no longer full and open competition. They're reserved for those vendors who have been selected to participate on that IDIQ. So I tell you all of this to say, if what you buy, if the history of the procurement has been through GSA or through a IDIQ, it is in your best interest to get on one of those schedules or whatever schedule the government buys from, rather than to try to talk a government official into leaving that procurement vehicle and doing it so that they can get to you. Does that make sense?
That's an excellent point. That is an excellent point. So you would really be hard pressed to move procurements away from an existing vehicle, or let me just say this, a pre-competed, pre-negotiated vehicle, right? Because some of these vehicles are considered best in class, which we have a requirement under category management. So if you don't know what that is, you need to get with that. Tiffany, you got to tell them about category management one day if you haven't already done so.
Will do.
Okay, and so that might not necessarily happen. What some things that could happen are whether or not if they were set aside before, maybe to have them set aside on the vehicles and things like that. Those types of changes are a little not as heavy. I wouldn't say lighter, but they're not as heavy as trying to remove it completely from a pre-competed, pre-negotiated contract. So, as Wayne said, it's in your best interest. If you see that that's where the history of the requirement has been and you want to compete for that work, then you go get on that. That being said, I just have a little caveat to Wayne's statement. We are, you make the best business decision for you. And because it takes time and money to do the work that is necessary to get on these vehicles, right? And mostly because they're long-term vehicles, especially the ones that have a specific award date and completion date, like your NITAC, CIOSP 4, for example, is coming out. It's going to be it's going to be 5-year base with a 5-year option, right? Whereas different with GSA has rolling awards onto the contract. So you have to make that business decision for yourself. We don't do that. Folks like the Ptac, there are so many answers that I could say Ptac, because they literally can help you with this. And you don't need to pay other people to give you this type of information and to help you with this. I would say 80 90% of what you need, you can get for services for free through your Ptac and your Ostaboo, right? And then if you need someone to take you the rest of the 10% the rest of the way, then do that. But if you're starting at 10% of the information, you're asking somebody to do 90, that might not be the formula for success. Thank you.
Great, thank you for that.
Ms. Tiffany, can I budge in and add one more critical part to the website?
Please.
Sorry, as everyone was saying hot, my dog had walked in from being on the porch and was breathing so hard, I had to pause. And I was trying to get through everything fast. So I wanted to show you that. Can you see my screen?
We see a pretty big black box in front of your screen. So I don't know if you can shrink your
You know
Zoom
what that
a
is?
little bit.
That is the question and
Yeah.
the question box, Q&A box, and it is, okay, here we go. All right, so on the screen you see it's the homepage for the website, and now I've done something crazy. Okay, here we go. So when you're on the homepage, when you go right in, of course, we talked about the industry tab. Right when you go in, it's the events information that you can register, right? When you go down here, and someone mentioned in the chat, they talked about the different Hubzone initiatives, and we'll get there. Here's the announcements area that will be here. You can search through opportunities right here from the homepage. You don't have to go through those individual tabs. But what I wanted you to see is this month we're featuring a Hubzone that participated in one of our Hubzone showcases. So if you are featured, we do feature you here. It goes right to your profile, which is pretty cool. And we also have some different Hubzone award information about for HHS. And what I wanted to show you is our goal information is right here, right in a snapshot if you wanted to see that. But here are some helpful links that I think that will interest you. And one of those is our contact information for the different small business specialists as well as our office. So I wanted to make sure you did see those in that information. Even before you do register, you can go in and kind of utilize those things first. All right.
That's helpful. Thank you. I think there's two questions that are related to professional services, and the other one is IT. Do you have a list of all of the multiple award contracts that you use, and for what purpose, somewhere on the Ostaboo site?
No, we don't have that on our website. So you're looking for the vehicles that we use for IT.
Or professional services was
Or
the other. Yep.
Well, so professional services, let's talk about professional services. So that falls under the mostly 541 sector. Wayne, jump in and help me with this if I'm getting it wrong. And okay. That is tens of thousands of procurements at HHS.
Yes.
To the tune of several $1 billion, anywhere from very small requirements, definitely under the set, to hundreds of millions. So no, we don't have that. But again, the information that you can get from data mining will help you with getting an idea of how we buy things, right? So I think, Karisma, if you want to pull up the one-pagers where they can find one-pagers, that's a good start. And Wayne, actually, I don't know if it was mentioned, he supports I have him supporting everyone. Thank you so much, Wayne. NIH, HRSA, and SAMHSA, right? And so
no, just HRSA and NIH, man. I'm sorry.
You're off the hook. Okay,
yeah.
Well, we have to put you back on.
Wait, what?
And so, we do use a lot of, for IT specifically, let's talk there. The CIOSP3 contracts right now through NITACs are, it's not a mandatory source in HHS, but it's used a lot. We have some agencies within HHS that have stood up their own IT contracts. So for example, at CMS, they had the Spark contract. My understanding is that they're not going to recompete that because there are other vehicles out there that have that. The depth and breadth of solutions they need with the, with a robust number of small businesses and contractors that can provide those solutions. IT 70 is another. IT 70 is also best in class. If you don't understand what I'm saying, best in class is nomenclature surrounding, it's called BICS, surrounding category management. So that's something to learn about, something that we're responsible for. Category management has to do with, leveraging the buying power of the federal government and getting, taking advantage of economies of scale. That's what it is that I'm trying to remember. So IT 70, but then you might look and see that some agencies buy more specifically out of certain sins on the schedule, right? So it's not just the schedule, it's a particular sin as well. So, there are a lot of things that go into this. So, so for us to provide a whole list, I'm not sure that necessarily gets you where you need to be. It's just more work for me to do, whoever asked that question.
Understand.
I'm busy enough.
And we can use our market research tool kits at all the PTACs have them to help businesses kind of sleuth out the answers for their particular industry.
Absolutely.
One last question about micro purchases. What is your micro purchase threshold, and how would businesses be in the right place at the right time to be considered for those?
See, Wayne, I just have a little sidebar for Wayne. See, Wayne, this is why I asked for the data call the way I did, right? A couple of weeks ago. So, in terms of the purchase card program, I mean, the Ostaboo has eyes on it. But that's not really, we kind of really don't chase and track that program all too much because the dollar value is so low. HHS doesn't have its own micro purchase threshold. It's the same throughout the federal government. It's $10,000. It was increased from $3,500 a couple of years ago in the National Defense Authorization Act of, I don't know, what was it? It was either 17 or 18. I can't remember. But it's $10,000. It's $10,000. Wayne, did you want to add anything? I know you have some information about NIH, about purchase card, right?
So, so about the I just wanted to talk on that question about the personal services contract.
Oh yeah.
Very briefly. And again, I geek out. This is why they don't let me out that much. But what happens? HHS last year did something like 70,000+ contract actions. There's a lot of things that can be, the contracting officers also picks the NAICS codes. So even if we said, okay, here's a list of everything under say 541-611, that may not be accurate, as the CO might have said, well, this work should go under a different NAICS code or something like that. So this is where, again, the research into who your potential client would be, what they buy and how they buy it is going to be very helpful for you. But we cannot provide that information to you. The government basically says that's what we did with setting up FPDS. So it would be, I think the agency sees it as redundant if we were to try to do that on our own.
Do your micro purchase threshold users within HHS utilize this SBCX platform to find vendors?
No, not really. The Ostaboo really is required to look at all requirements greater than 25,000, and below the micro purchase threshold, it's kind of a we assume that it's going with small business, but it's not a kind of a thing that we have to track. As a matter of fact, because to tell you how to show you a little bit of how the sausage is being made, the micro purchases are on government cards. So the government cards are managed by a total different entity, and they don't report to us. They don't turn in any data to us.
Right.
So that's important to know, okay?
Right. Usually thank you, Wayne. That's a good point, because usually the purchase card holders in the government that have the authority to purchase under the micro purchase threshold, which is now $10,000, which is good. You can
Good.
buy a lot more things, it's more than double than what it used to be. So you can buy a lot more with your credit card than you could before. But usually it's somebody in a program office that has a credit card in the drawer that they say, hey, we need you to have this credit card just in case we need to buy something at the last minute, right? So it doesn't go through the procurement process that other requirements do.
Great, thank you. Very good. I think that we are really short on time. I know that we are very grateful for you all three of joining us today, sharing your expertise and information on how to do business with HHS. We're looking forward to your big event next month where, or I guess in June, where businesses would have an opportunity for kind of small business roundtables with some of your staff. And so we'll get that information out to the attendees here today, as well as the recording and the slide deck. Any last thoughts from anyone on the line as a panelist here today that would want to close us out with?
I would like to say thank you, Tiffany, for doing this. Thank you, Alicia, for doing this. It is a privilege to serve in federal service. It's a privilege to serve the American people. I don't think any of us on this line, on the Ostaboo side, take that for granted for a day. And we encourage you to do your best, to be smart about it, but to do your best in marketing to the federal government. Thank you.
Thank you. Karisma, any last thoughts there before we close it out?
Wayne actually gave that last thought and it was amazing. So I'm going to stick with that. And we really, again, appreciate you, Ms. Marnie and Ms. Alicia, for assisting us. And whatever you need help in, I know we've done some projects earlier with you. We'll continue to be supportive. Thank
Excellent.
you again, and have a wonderful rest of your day.
Great. Thank you for coming, everyone. We'll be in touch. Take care.
Bye.
Bye-bye. God bless.